My name's Damian. I'm going to be giving you your Red Cross CPR today and first aid. We have a ankle that we're going to get to play around with because what'd you do? You fell last night playing basketball?
I just twisted it. Really
Just twisted it? So when we get into the first aid portion of our class later, we'll tape up his ankle and see kind of a good way to wrap it. We're going to look for skin color. We're going to look for pulses and just kind of see how to put a wrap on without cutting off circulation and without hurting the individual when we do it.
Let's hope so.
Yes. We won't hurt you too bad when we do it. We got the ice. You should be all right. Has anybody in here taken the CPR before? Is this a recert? Okay. What you're going to find out today is that the Red Cross has changed a lot of what they have done. In July, they changed their program up. It was one way for 5 years, and now everything has changed. So we'll get through the changes. For the most part, CPR is still going to be doing your compressions, your breathing, checking for circulation. We're no longer searching for pulses. We're just looking, skin color, basically looking to see if they've got good chest rise and fall. And beyond that, that's the only assessments that we're going to do when you have an unconscious victim. If there's not any questions yet, I'm going to go ahead and I got to show a brief video. It's going to be showing how you're going to be recognizing cardiac emergencies. Once we get through that video, I'm going to pull somebody up here and show how to do an assessment on a conscious individual. A little bit later in the class, we'll go into the back and we'll start rolling each other around and practicing some of the skills on ourselves. And I'm very technologically challenged, so I'll grab the wrong remote about 5 times today. Is everybody able to see it, hear it?
Rich Fellner.
I'm Brenda Beasley.
My name is Cherie Brackett.
My name is Thomas Beasley.
First symptom was severe indigestion, which was not fixed by an antacid.
First thing was the chest pain. I noticed that almost immediately. It was very uncomfortable. Felt like somebody was standing on my chest.
Seemed like it was getting tighter, like a fist was in there. It was like something was just crushing it.
Then came profuse sweating just out of nowhere.
Pain radiated right up into my jaw, and then down into my arm and fingertips.
And all of a sudden you can't breathe and you start sweating and your chest start hurting. Something's wrong.
Then a sense of doom that the whole world was coming to an end.
Was very scared. Had decided that it was time to tell my wife. It was time to go to the hospital and see if it was in fact what I feared, which was a heart attack.
I told my wife, I said, I have never felt this way, and I was serious when I told her this too. I said, it's time to go. She probably looked at my face and said, he's not playing.
Sweating, he was sweating, and things that he never did before that made me know something was wrong.
It's important to know what to do when someone that you love becomes pale or sweaty and has chest pain.
It can happen to anybody, and it can happen overnight. It can happen in the blink of an eye. I'm just very glad to be here telling the story, and then I knew what to look for.
Sometimes I get a little emotional when I talk about it. Usually a tear drop out of my eye, because this was real serious.
So I immediately got help. I went to someone at the front of the store and asked them to call 911 for me. And within 15 minutes, I was in the hospital emergency room being treated for a heart attack.
Because it can happen at any time and anywhere. And you just don't know when it's going to happen.
I'm glad to be here today.
He's my beat. He's my beat. And I love him. I love him a lot.
So that's kind of the weepy part of the program in a way. It's just individuals talking about the various symptoms of heart attacks that they've had. Do you know the difference between a heart attack and cardiac arrest? It's going to be a big thing that you're going to need to decipher when you're going to be doing CPR. Does anybody have an idea? No? With your heart attack, like what they were showing here, the guy's talking. He's saying that he's getting a lot of sweating going on. He's got this crushing pain in his chest. Sometimes it'll radiate down the arm when you're having that pain, but he's awake. He's talking. and he's alive. That's going to be more of your heart attack symptoms. With cardiac arrest, that's where we're going to be doing our CPR. Cardiac arrest is where your heart has gone into a rhythm where it's no longer putting blood throughout the system. Somebody in cardiac arrest is going to be laying on the floor, not making any sounds, not responding to anything that you're doing. So we don't do CPR on a heart attack victim necessarily, but we will always do CPR on a cardiac arrest victim. Does that kind of make sense? Now, the first thing that you're going to need to know is a system called check, call, care. Has anybody heard that from the classes before? It's just, you're going to check your scene, looking around, to make sure that it's safe for you to approach. You're checking your victim to make sure that they do need medical treatment. You're checking, again, like I said, you're checking the scene still to make sure that it's safe. Then you're going to go on and you're going to do the care portion where you're going to treat the wound or the injury that you're coming across. So the way that you're going to do that with a conscious individual, and if you don't mind me using you for an example just so I can use your foot. What you're going to have is when I walk up here, I'm looking around and what I'm seeing when I'm doing the first part of my C's is my check. I see that it looks like there's an injured ankle. So now I'm going to check with you to make sure that it's okay that I would be able to look at it or treat you in any way. So I'd come up and introduce myself. My name's Damian. Is possible that I could help you out with your foot here? All right. Now, we have consent laws. If he tells me no, at that point, I'm not able to treat the injury. So anytime somebody tells you to leave them alone, you need to abide by that and step back. Doesn't mean that you can't call 911 if you feel that the condition warrants it and kind of stay with the person. I wouldn't suggest like hovering in their face while you're waiting for 911, but kind of stay back. If the situation gets worse, if they go unconscious, then you could step in, consent changes, and you'd be able to treat.